Every human has to be born to exist, meaning a mom has to be pregnant and then have a baby through labor and childbirth. Today I'll be talking about how maternal mortality in the United States is at a higher rate than it should be, and I'll be talking about how the United States system is broken. One reason the United States system is broken for women and babies is because the United States healthcare system relies on a profit, and it's operated like a normal business like you would see in the corporate level. And part of the reason why this is a problem is that hospitals rely on their patients to pay up for the services that they're using. And more Americans are living in poverty than most other countries that are also developed. In my interview with Dr. Donna Schmickney on February 7th of 2020, she stated, "Care is on a doctor's schedule for women and babies." This means that women and babies who are in the hospital, if their labor is taking too long to progress, they're more at risk for having a C-section, which can give them unexpected risk. Another reason that maternal mortality is high in the U.S. is because Americans are not as healthy as most other countries. According to the CDC, 6 out of 10 Americans have at least one chronic illness. And according to Stephen Wolf and Loudon Aaron's 2013 book, U.S. and International Perspective, they explain that for decades, most Americans in this country have been the most obese, and that puts us far more ahead than any other country when you're talking about obesity. Since Americans are not as healthy, many women need more care during their pregnancy and after during their postpartum care. And for many women, especially women on Medicaid, this care is not available for them after they have a baby and 60 days after their delivery. In Jewel M. Mullen's article, Maternal Mortality, a U.S. Public Health Crisis, in the American Journal of Public Health, she states that 70% of women experience at least one birth-related complication within a year of having birth. For a lot of these women, that means for over 300 days, they have no health care that is going to take care of them during their postpartum. European countries are more effective and more on top of the ball with their maternal health care. They have some of the lowest infant and maternal mortality rates, and this is because they minimize competition between physicians or obstetricians and midwives, and the intensity of care is based on risk, which is taken by a series of tests that look at over 100 symptoms and put them in a category from high risk all the way down to low risk. The high risk candidates have to be seen by an obstetrician, and the low risk can go with a midwife. According to Eric Parlin's article, Midwifery in the Netherlands, on the Midwifery Around the World page that was last updated on December 13th of 2018, there's a greater emphasis, especially in the Netherlands, on giving birth at home with a midwife rather than in a hospital with a surgeon. And this also has a lower rate of C-sections in the Netherlands especially. There are fewer physicians that are able to perform them, which gives less of a risk that women will be put into C-sections because their labor is taking too long. Another way that European countries have made a lower mortality rate for women, they use less medications to speed up the labor process. Labor medications can make labor faster, but they also give more pain during contractions. Drugs like Pitocin or Servidil can compromise the amount of blood flow and oxygen reaching the baby, which puts the mother at risk for having a C-section, which is again more risk toward the mother's health. The increasing pain levels is another side effect, which is increasing the risk that the woman will need pain management drugs to manage the pain of her contractions. These pain-relieving drugs do slow the rate of labor. Longer the labor lasts, the higher the risk of a C-section. And this can be a serious problem. As a country, the United States has a lot of room to improve to limit the amount of women we're losing by having children. We need to look at other countries such as the Netherlands and Germany. And a lot of these countries, they've already figured it out. We don't need to be giving women drugs all the time. It will take time, and we can't do this in one day. We need patience, but we can significantly decrease the amount of babies and moms that we lose to childbirth. Thank you.